some support. I like to put I like to use my body to help me. So what I'm doing is, you can do it with the knee straight, but there you're not going to get a good assessment because the knee will be in a closed pack position.
Yeah.
So I kind of have the patient bend their knees to about 10 degrees, right? And then I'm going to be checking the medial collateral ligament. So I'm going to push medially against the distal femur, and laterally I'm going to bring her lower leg out.
Yes.
That's checking the MCL.
That's a valgus stress.
That's a valgus stress test.
Okay. Medial.
So see, her leg looks like an L, right? Now I'm going to do the varus stress test, which is the same thing,
Just opposite.
but I'm switching hands. So this hand is pulling out and this one is pushing in. You see? And again, this test you can do with her knees bent, and then also do with the knee straight, but I don't like straight because you're working with the knee in a closed pack position and it's not going to give you an accurate result unless if it's really, really bad.
Yeah.
Okay, yes.
I saw a video where they had the actual leg off to the side here, and they did it this way too, depending if the patient's leg is too heavy. Like if you're like a smaller person.
They could, but the
this
thing
way
is,
and
you
then
got to be careful
this
because
way.
you can also internally rotate. So you got to find what's best for you, as long as you're focusing on the correct position and you're focusing on the correct structure. Like on hers, I felt more comfortable bringing my leg up and just relaxing her leg on mine, and then
And the Lockman, it's hard to get your hand like on
that's
the
the next
tibia.
one, right? Lockman?
Yep. No, next one we're going to do is anterior, posterior drawer, then followed by Rockman.
Anterior, posterior drawer. You can scoot up a little bit more. Good. So I'm going to have her bend her knee. I like to sit on the patient's foot.
Yeah.
For stability, I put my thumbs around her tibial tuberosities and against the superior aspect of the tibia, and then I do a pull. Okay? So I'm pulling her tibia forward. And what is that checking for?
The ACL.
ACL. Okay? So that's ACL. Now let's say I'm doing PCL, the posterior drawer sign. I'm pushing back.
Okay.
Okay, which that's hard to do that way. But because she's normal too,
Yeah.
she was abnormal, I could maybe see her tibial plateau.
And if they have a sag sign, you don't have to do a posterior sag sign. If they have a sag sign, you don't
Right.
Is it sag or lie?
Listen to this. If you put her knee in flexion like this and her tibia sags back, you already know.
Don't even mess with that knee.
That's a positive sag sign. You really don't have to do a PCL check, right? Because that PCL is blown.